imagine that you have a fever and you go to the doctor to find out what's wrong. The doctor draws some blood and finds that you have an increased number of white blood cells and some proteins. This tells the doctor that you most likely have an infection. And then the doctor can decide on further tests and determine the best course of treatment for you. These two things, which help the doctor diagnose you, are called diagnostic biomarkers, and they can be thought of as a crystal ball for the doctor. If they are there, it means that you have a specific disease. Similarly, you can also get crystal balls that can tell you if a patient will respond to a particular drug. In order, and this is the focus of my PhD. In order to do this, I will first analyze the blood from patients with a damaged immune system that belong to a specific disease group. And from now on, I shall be referring to them collectively as patient A. The crystal ball in this case is a special group of cells that only exist in patient A and not in healthy people. The reason why these cells exist in the first place is because of mutations in two genes that leads to an increased activity of this particular protein, which in turn has drastic effects of changes in the frequencies of various cellular populations of the immune system, and this in turn damages the immune system over time. So, if these cells are present, that means these patients have increased activity of the protein, and therefore these cells are the marker of this increased activity. Once I have found these cells or the crystal ball, I will try to find it in patients of other diseases that belong to the complex disease group. And they have symptoms that are similar to patient A. So it is possible that a small fraction of them might also have increased activity of this protein. And if so, this crystal ball can help us find them, and their symptoms can be reduced with treatment with a drug that is specifically targeted and its function is to normalize the overactivity of this protein. And with this, their symptoms will reduce and they will also get much less side effects. This is also the standard treatment for patient A. So in conclusion, the main aim of my PhD project is to extend personalized treatment options to patients of complex diseases where the relationship between the cause of the disease and the best treatment option is often blurred. Furthermore, this can also help doctors efficiently and accurately differentiate between patients that have similar phenotypes or similar symptom presentation by differentiating between them at the molecular and cellular level, as it is the information at this level which often gives the doctor the best indication of the match to be made between the patient and the drug that will most likely help them get better. Thank you.